Welcome to the deep dive. Today, we're digging into a topic that, well, it could be pretty worrying if you have pets. We're talking about hypoglycemia in dogs and cats.
Low blood sugar.
Exactly. We want to unpack what that really means. What happens when their blood sugar drops too low and why it's so important to understand.
Yeah, absolutely. It can be quite serious.
So, our mission here is to pull out the key info from the source material we looked at, excerpts from Canine and Feline Hypoglycemia. We want to give you a clear picture, without getting totally bogged down in super technical jargon.
Right. We're aiming to shed light on it, drawing straight from that source. We'll look at how it happens, the signs to watch for, and how vets figure it out and treat it.
Okay, let's jump in then. So hypoglycemia
Mhm.
basically is just what it sounds like, right? Abnormally low blood glucose.
Yep. Low sugar in the blood.
Mm.
But it's more than just a bit of low energy. It hits two main systems pretty hard.
Which ones are those?
The musculoskeletal system, think muscles and movement, and the nervous system.
Ah, okay, so that explains some of the signs people might see.
Exactly. Things like weakness, muscle twitches, that's the musculoskeletal side, and then seizures, weird behavior, that's the nervous system involvement.
And the source mentioned these signs can be episodic, like they come and go.
That's a really key point, yeah. They might seem fine 1 minute and then show signs the next, which, can make it harder to spot sometimes.
Okay, so we know what it is and why it's a concern. Let's get into the how. How does this low blood sugar actually happen? What are the main pathways?
Well, the source lays out four main mechanisms. The first one involves having too much insulin around, or things that act like insulin.
Insulin. That's the hormone that helps sugar get into cells. Right?
That's close. It's like the key unlocking the door for glucose.
Yeah.
So if you have way too much insulin or something mimicking it, it just pulls too much sugar out of the blood too quickly.
Okay. Can you give us some examples? What kind of situations cause that?
Sure. A classic one is an insulinoma. That's a tumor on the pancreas that just turns out excess insulin.
Yeah.
Then there's something called extrapancreatic paraneoplasia. A bit of a mouthful, I know.
Yeah.
Basically, some other tumors, not on the pancreas, can produce a substance, IGF-2, that acts a lot like insulin.
Interesting. What else?
Xylitol poisoning. That artificial sweetener, extremely dangerous for dogs, causes a massive insulin release.
Right. I've heard about that. Scary stuff.
It really is. And then, unfortunately, there's iatrogenic insulin overdose.
Iatrogenic, meaning caused by treatment.
Exactly. Accidentally giving too much insulin, usually to a pet being treated for diabetes. It happens.
Wow. Okay. So too much insulin or insulin-like stuff is number one. What's the second mechanism?
The second one is about the liver not doing its job properly in terms of making glucose. Liver's crucial for keeping blood sugar steady
How does it do that, usually?
through two main processes: gluconeogenesis, that's making new glucose from other sources, and glycogenolysis, breaking down stored glucose called glycogen.
Okay, so making it and releasing stores.
Yep. And if the liver's sick or damaged, it just can't keep up with that production.
And what kind of things would stop the liver from working properly?
Well, actual liver disease like severe hepatitis or cirrhosis, which is scarring.
Mm-hmm.
Also, certain genetic conditions called glycogen storage diseases, where they can't store or release glycogen correctly.
Okay.
And other conditions can affect it too, like hypoadrenocorticism, that's Addison's disease, and sepsis, a really severe infection.
Sepsis again. Okay. That makes sense for the liver. Now, the third mechanism you mentioned was excessive use of glucose, like the body's just burning through it too fast.
Exactly that. The demand just outstrips the supply. We see this in working dogs, like hunting dogs after intense exercise.
Right. They use a ton of energy.
They do.
Yeah.
Also in pregnancy, because the mother's supporting the growing fetuses, certain cancers or neoplasia can use up a lot of glucose too.
Okay.
And a condition called polycythemia, where there are too many red blood cells, increases metabolic demand. And yes, sepsis comes up again here too.
How does sepsis cause overuse?
In sepsis, you get this big inflammatory response.
Mhm.
Immune cells, called macrophages, become very active in certain tissues, and they produce substances called cytokines.
Mm-hmm.
These cytokines ramp up glucose use in those tissues.
Wow. Okay. So the body's own response makes it worse in that case.
In a way, yes.
Yeah.
It's part of the complex reaction to severe infection.
All right. And the fourth and final mechanism.
The last one is basically not getting enough glucose in, or the body not producing enough from the start. reduced intake, or underproduction.
Who does that usually affect?
This is really common in very young puppies and kittens.
Yeah.
Their systems aren't fully developed and they don't have big energy reserves.
Makes sense.
Also affects toy breeds, the really small dogs for similar reasons, small size, limited stores.
Okay.
We also see it with those glycogen storage diseases we mentioned earlier, and obviously in cases of severe malnutrition or just plain starvation. And interestingly, the source links this back to sepsis too. If an animal with sepsis is already malnourished and low on glycogen stores, those inflammatory cytokines can also block the liver from making new glucose, gluconeogenesis.
So it's like a double whammy in that situation.
Pretty much, yeah. Hits them from both sides, increased use and decreased production.
This really helps clarify the why behind it all.
Yeah.
Okay, let's switch gears to the what to watch for. What signs might an owner actually see?
The signs can be, well, quite varied, but we can group them. Neurologically, you might see seizures. That's a big one.
Okay, definitely serious.
Yeah. Or posterior paresis weakness in the back legs. Ataxia, which is like being uncoordinated, stumbling.
Wobbly.
Yeah, wobbly is a good word for it.
Yeah.
And even just changes in behavior, acting confused, disoriented, not themselves.
Okay. And what about more general sort of physical signs?
You might just see general weakness or even collapse. Muscle twitches, the source calls them fasciculations.
Right.
Lethargy or depression is common too, just seeming really tired, withdrawn.
Any other signs? Maybe less obvious ones?
Yeah, there are a few others. Sometimes, believe it or not, increased appetite polyphagia, or even weight gain in some chronic cases, like with insulinomas.
Huh, interesting.
You might also see them drinking and urinating more PUPD, vets call it, and exercise intolerance, just getting tired out way easier than normal during walks or play.
It sounds like quite a range.
It is, and it's really important to remember what the source says. Sometimes the animal might seem totally normal apart from signs of whatever underlying disease is causing the low sugar.
And that episodic thing you mentioned earlier.
Exactly. It might not be constant. The source also mentions polyneuropathy nerve damage as a possible sign, maybe in more long-standing cases.
Okay, so not always straightforward. Now, we touched on causes when discussing mechanisms, but let's maybe organize them a bit more clearly. How can we categorize the main causes?
Yeah, good idea. We can group them into, say, endocrine problems, liver disease, glucose overuse, reduced intake production, and toxicities.
Okay, endocrine first.
Right. So under endocrine, you've got insulinoma, that pancreatic tumor, and that extrapancreatic paraneoplasia, where other tumors make that insulin-like stuff, IGF-2.
Do they mention specific tumor types for that?
They do, yeah. Things like liver tumors, hepatocellular carcinoma, or adenoma, or certain tumors in the intestine like leiomyoma or leiomyosarcoma.
Okay.
And of course, the iatrogenic insulin overdose fits here, as does hypoadrenocorticism, Addison's disease.
Got it. What about liver problems, hepatic disease?
Under hepatic, you've got conditions like portosystemic shunts, where blood bypasses the liver, cirrhosis, that's scarring, severe hepatitis, which is inflammation, maybe from toxins or infection, and those glycogen storage diseases again.
Okay. And the overuse category?
Yep, that includes the hunting dog, hypoglycemia, intense exercise, pregnancy, polycythemia with the extra red blood cells, neoplasia or cancer, and, as we keep mentioning, sepsis because of how it ramps up glucose consumption by those immune cells.
Right, the cytokines in macrophage-rich tissues.
Okay.
And reduced intake or underproduction?
That's mainly our young puppies and kittens, the toy breeds, and then severe malnutrition or starvation. And remembering that sepsis connection where cytokines can also block glucose production if glycogen is already low.
Okay. And finally, toxicosis.
Here we have the insulin overdose again, definitely xylitol poisoning, and also poisoning from other antihyperglycemic drugs like sulfonylurea is sometimes used in human diabetes treatment.
That's a lot of potential causes. Are some animals just more prone to this? What are the risk factors?
Well, the source points out something fairly intuitive. If an animal already has a condition causing overuse or underproduction of glucose, then not getting enough calories, low energy intake, makes them much more likely to become hypoglycemic.
Stands to reason. If the tank's emptying fast or not filling up, you need enough fuel going in.
Exactly. But interestingly, for insulinoma patients, it's a bit less predictable. The source says things like fasting, excitement, exercise, even eating. Sometimes they trigger an episode, sometimes they don't.
Really? Why is that?
It seems the tumor just releases insulin whenever it wants, kind of erratically, not necessarily tied to those usual triggers. Makes it really unpredictable.
Wow, that must make diagnosis a real challenge sometimes. How do vets figure out what's going on when they suspect hypoglycemia?
It's definitely a process, It usually involves ruling out other things. First, the differential diagnoses plus specific lab tests and often imaging.
What other conditions might look like hypoglycemia?
The source lists quite a few. Hyperinsulinism itself, obviously, Addison's disease, those portosystemic shunts, liver issues like cirrhosis or severe hepatitis, sepsis, glycogen storage diseases, the extrapancreatic tumors, even just really large cancers taking up glucose.
So how do they narrow it down?
They'll look at the whole picture, the animal's age, breed, other signs they're showing, piece it all together.
And what about blood tests? What clues can they provide?
First off, sample handling is super important. Glucose levels can drop falsely low in the tube if the serum isn't separated from the red cells quickly.
Ah, good point.
Yeah, so if it's going to be delayed, like more than half an hour, they need to use a special tube, usually with sodium fluoride, to stop the glucose breakdown.
Okay. And what might the results show?
It varies a lot. With hyperinsulinism, surprisingly, routine bloods might look pretty normal sometimes. But with Addison's, you might see electrolyte imbalances, sodium, potassium, and changes in blood proteins.
Right.
Portosystemic shunts might show up with small red blood cells, microcytosis, a low BUN level, maybe slightly high liver enzymes.
Okay.
More severe liver diseases often have really high liver enzymes, maybe high bilirubin causing jaundice. Polycythemia shows a high red cell count, or PCV. And xylitol poisoning often causes low potassium and high liver enzymes.
So standard tests give clues, but you often need more specific ones.
Absolutely. If an insulinoma is suspected, the key is measuring glucose and insulin at the same time, usually after fasting. Finding high insulin when glucose is low is really suggestive.
Makes sense.
The source also mentions the AIGR adjusted insulin to glucose ratio. It's a calculation that helps interpret those results. An AGR over 30 often points towards insulinoma, though false positives can happen, especially if glucose is extremely low.
Okay. What other specific tests?
For suspected Addison's, the ACTH stimulation test is the gold standard. For liver shunts or dysfunction, they'll often run bile acid tests, both fasting and after a meal, though high bilirubin can interfere.
Right.
If sepsis is on the table, a blood culture to look for bacteria is crucial. And for chronic, ongoing low sugar, measuring fructosamine gives an idea of average glucose over the last few weeks.
And I guess imaging must be important too.
Definitely. Abdominal x-rays and ultrasound can help spot some things, other tumors, big masses, signs of shunts, or liver disease, like changes in organ size or texture.
Can they see insulinomas easily with those?
Not always, especially if they're small. Ultrasound can sometimes pick them up, but abdominal CT scans are generally considered more accurate for finding pancreatic tumors like insulinomas.
Okay, CT is better for that.
Yeah. And then for diagnosing liver diseases like cirrhosis or glycogen storage diseases definitively, a liver biopsy is often needed. That can be done with ultrasound guidance, keyhole surgery, laparoscopy, or open surgery.
Right.
And there are some specialized imaging tests just for portosystemic shunts, like scintigraphy or mesenteric portography.
Wow, it really sounds like a thorough detective work sometimes. Okay, let's talk treatment. What happens once they figure out it's hypoglycemia? How do they fix it?
Well, if an animal is showing clear clinical signs, weakness, seizures, they usually need inpatient treatment, supportive care at the vet hospital.
Okay. What does that involve initially?
If they're awake and not vomiting, sometimes just feeding them a meal that's easy to digest can help. But if they can't eat, then typically intravenous fluids with dextrose, that's a type of glucose, are started.
Like a sugar drug?
Essentially, yeah. In more severe cases, they might give a slow IV injection of a really concentrated 50% dextrose solution. And if they suspect an insulin-producing tumor is the cause, they might give an injection of glucagon, which works to raise blood sugar. Surgery might also be needed, depending on the cause, like removing a shunt or an insulinoma, if possible.
What about emergencies at home? That sounds terrifying for an owner. What can they do?
Yeah, the source gives some really specific, important advice here. Number one, if the pet is actively seizing, do not try to put anything in their mouth.
Right, they could choke or inhale it.
Exactly. Very dangerous. Short seizures often stop on their own in a minute or two, but if it goes on longer than that, get them to a vet immediately.
Okay, what if the seizure stops or they're just weak and wobbly?
Then you can try rubbing something sugary like corn syrup, or even that 50% dextrose if your vet has supplied it, directly onto their gums. Inside the cheek, the buccal mucosa.
Why, if it comes?
It can get absorbed fairly quickly through those membranes. Once they're conscious and can swallow normally, then you can try giving a small amount of sugary food or liquid by mouth, whatever your vet recommended.
But they still need to see the vet right away.
Oh, absolutely. Even if they seem better, you need to find out why it happened. Owners of diabetic pets might actually be trained by their vet to give injectable glucagon in emergencies.
Okay. And for initial management?
Frequent small meals are often recommended, using a diet that's not high in simple sugars to avoid big sugar spikes and crashes. Or, if they can't eat, continuing those IV dextrose fluids.
Right. What about longer-term management?
Long term, it's really all about treating the underlying cause. So for insulinoma, management is complex, often involving specific medications or surgery. That's kind of its own topic.
Okay.
For hunting dog hypoglycemia, it's about diet, feeding them properly before and during exercise with foods that give sustained energy.
Right.
For those little toy breed puppies or kittens, it's often just about feeding them more frequently through the day. But for most other causes, the main strategy is treat the underlying disease, whatever it is.
Are there any treatments that should absolutely be avoided?
Yes, definitely. You obviously wouldn't give insulin. That would make things much worse. And the source advises against using certain sedatives like barbiturates or diazepam, specifically for hypoglycemic seizures. They don't fix the low sugar, and in animals with certain liver conditions like shunts or severe failure, they could actually worsen a serious neurological complication called hepatoencephalopathy.
Okay, good to know. Any precautions vets need to take when giving treatments?
Yeah, a couple of important ones. That concentrated 50% dextrose is really caustic, can cause severe tissue damage if it leaks out of the vein.
Ouch.
Yeah, so ID access has to be perfect. And generally, you shouldn't use dextrose stronger than 5% unless you're certain you have good IV access. Also, just giving a quick shot of strong dextrose without following up with food or a continuous drip can cause rebound hypoglycemia.
How does that happen?
The sudden sugar spike can trigger the body to release a surge of its own insulin, which then drives the sugar back down too low again.
Ah, okay. So you need sustained glucose support. What about follow-up after an episode?
At home, owners really need to watch closely for any signs coming back. Checking blood glucose at home sometimes helps, but the source notes it has limitations because sugar levels fluctuate naturally.
Right.
So monitoring really depends on the underlying cause. If it was an insulin overdose in a diabetic, the vet will likely want to recheck how they respond to insulin, maybe do a glucose curve, and adjust the dose.
Makes sense. And what's the main risk if hypoglycemia isn't managed properly long-term?
The biggest worry is having recurrent episodes, potentially getting more severe over time, especially if the underlying cause isn't found and treated effectively.
Okay. This has been incredibly informative, a real deep dive. So I guess the main takeaway is hypoglycemia in pets isn't just one thing. It has loads of potential causes.
Exactly. Which means getting the diagnosis right is key.
And then getting the right treatment quickly is crucial. Recognizing those signs early and getting to the vet, that can make a huge difference.
Absolutely. And, considering that huge range of underlying conditions, liver problems, endocrine issues, infections, tumors, toxins, it really makes you think, doesn't it?
How so?
Well, what other, maybe subtle or seemingly unrelated signs might our pets show that could actually hint at a deeper metabolic problem like this? It's a good reminder to really observe our pets closely and talk to the vet about anything unusual.